There are many factors that contribute to a healthy prenatal development. The three that I'm going to discuss today are drugs, nutrition, and age. Under drugs, there are three subtopics on which I will touch base on. One is smoking, alcohol, and caffeine. Smoking is not only bad for you, but it is bad for your baby as well. Smoking during pregnancy reduces the amount of oxygen that the baby receives and increases the risk of miscarriages, bleeding, and morning sickness. Chemicals inhaled while smoking may lead to other health problems with the baby: reduced birth weight, premature birth, increased risk of SIDS, and stillbirth are other possible consequences. Pregnant women should also avoid secondhand smoke. Alcohol. Drinking can cause fetal alcohol syndrome, including symptoms like low birth weight, medical problems, and behavior abnormalities. As soon as you know you are pregnant, you should stop and withdraw drinking alcohol. Caffeine. There are many conflicting studies about caffeine and pregnancy, and some believe that caffeine is not harmful as it once was thought to be. Nevertheless, the FDA warns against caffeine consumption during pregnancy and suggests quitting or reducing consumption at the very least. Caffeine has been shown to affect fetal heart rate and awake time. Decaffeinated coffee can also be harmful since producers often add additional chemicals to remove the caffeine. Caffeine can also increase risk of stretch marks. Suddenly quitting caffeine intake can cause headaches, so most experts recommend that you gradually reduce the amount consumed. To go back talking about nutrition, nutrition also has a sub-factor of exercise. And I think the two kind of go hand in hand. Good nutrition is critical to a developing child. Practically getting enough folic acid. Lack of folic acid can cause birth defects. At least 400 to 1,000 micrograms of vitamin B is suggested. It is also suggested that you start taking a prenatal vitamin once you become pregnant. Leafy vegetables, orange juice, and beans are also some natural sources of folic acid. Many stores sell vitamins with folic acid as well. Exercise. Moderate exercise is helpful as it improves the mother's mental state and can increase oxygen flow to the fetus. However, overexertion can be dangerous. Most experts recommend reducing your exercise intensity during pregnancy. Activities like walking, swimming, and yoga are popular for pregnant women. The last factor that contributes to a healthy prenatal development is age. Teen pregnancy. Pregnant teens are more likely to develop high blood pressure and anemia and go into labor earlier than women who are older. Teens may also be exposed to sexually transmitted disease or infection that could affect their pregnancy. Teens may be less likely to get prenatal care or to make ongoing appointments with healthcare providers during the pregnancy to evaluate risk, ensure that they are staying healthy, and understand what medications and drugs they can use. So there's a fine line, because then if you go over 35, most doctors say you're over the age of being pregnant, your prime time. But older first-time mothers may have normal pregnancies, but research indicates that these women are at risk for having a cesarean delivery, delivery complications including excessive bleeding during labor, prolonged labor, which means that it could last over 20 hours, and labor that does not advance. Or there could be an infant with a genetic disorder for mothers who are pregnant over the age of 35, such as Down syndrome. Thank you so much for listening to my video about what factors can contribute to a healthy prenatal development.